Senator from Alabama.
Mr. President, I rise today in disbelief. The American public is searching for common sense answers from its leaders on health care, and yet they're poised here to receive an expensive, wholly inadequate, and simply, Mr. President, illogical so-called solution. After weeks behind closed doors, including now, the majority has produced a bill thus far that raises taxes, makes drastic cuts in Medicare, and increases premiums to create a new government program, the so-called public option. Mr. President, I believe that the public option is nothing more than socialized medicine and expanded government disguised as greater choice, and thus I'm adamantly opposed to this bill as it's written. Mr. President, any legislation seeking to effectively address health care reform should have, I believe, as its dual aims, cutting costs and increasing access to quality care. But amazingly, Mr. President, this bill just does the opposite on both counts. This proposed legislation is not going to solve our nation's health care problems, and yet likely will exacerbate them. The administration, it seems to me, seems to be determined to force the health care bill on the American people, which the majority of citizens do not want or need. Mr. President, I believe that we have the best health care system in the world in the United States of America. And while many have scoffed at such a suggestion, the United States, as we know, has the finest doctors, first-rate treatments, cutting-edge innovation, and low wait times. Think about it. People come from all over the world to take advantage of our revolutionary medicine and state-of-the-art treatments. The United States develops new drugs and medical devices years before the rest of the world. And American doctors are usually, Mr. President, pioneers of new techniques in surgery and anesthesia. As a cancer survivor myself, I'm especially proud of the great strides the U.S. has made in screening and treating cancer. The U.S. has one of the highest survival rates for cancer in the world and dwarfs survival statistics in Europe. In 2007, U.S. cancer survival was 66.3%, while Europe's was 47.3%, Mr. President. I believe the answer as to where to receive treatment in the world is clear: the United States of America. However, our current system, I would admit, is not perfect, and I have never said that it was. But I believe we must seek to build upon rather than tear down these strengths that we have. We need a bill, Mr. President, that reduces cost and improves quality and level of care for the American people. Here, I believe we get the exact opposite: a bill that grows big government by creating a costly new entitlement program, drives up private health care costs, and subsequently, Mr. President, lowers overall quality and access to care. According to the Congressional Budget Office's long-term budget outlook, the coming tsunami of Social Security, Medicare, and Medicaid costs are projected to push the federal public debt to 320% of GDP by 2050 and over 750%, Mr. President, by 2083. Does anyone truly believe that this new legislation will not further add to our nation's debt? When has history proven that our government can regulate more effectively than the private industry or the marketplace, much less doing so without adding to the deficit? The reason, Mr. President, we simply overspend and overpromise. The Congressional Budget Office estimates, Mr. President, that the Senate Democrats' health care proposal, as now written, will cost $849 billion over 10 years. And, Mr. President, while Americans will be hit immediately with new taxes and government mandates, the actual services and coverage promised here in this legislation will not be implemented until 2014, a clear attempt, Mr. President, to mask the true cost of reform.